Okay, we'll start here in just about a minute. Okay, well, I'd like to formally welcome everybody again to our regular Friday virtual news conference. I'm Chuck Carney, Director of Media Relations for Indiana University, and today we will again meet with people from the City of Bloomington, Indiana University Health, Monroe County Emergency Management, Monroe County Health Department. With us today will be the City of Bloomington Director of Public Engagement, Mary Catherine Carmichael, Monroe County Commissioner Julie Thomas, IU Health South Central Region President Brian Shockney, Monroe County Health Department Administrator Penny Caudle, Monroe County Emergency Management Director Allison Moore, and Indiana University Associate Vice President for Public Safety and Institutional Assurance, Ben Hunter. And to start off with, we'll have some statements, first of all, from Mary Catherine Carmichael. Got to unmute Mary Catherine.
You know, I've done enough of these lately. You'd think I'd know that. Thank you, Chuck. And thanks to everybody who's tuning in. I want to begin with speaking on behalf of Mayor Hamilton and his wife, Dawn Johnson, and they thank you. Dawn has suffered the loss of her mother overnight, and the condolences are coming in quickly and lots of them, and they're very, very grateful. This is a very difficult time for their family, and so all the kind words are certainly appreciated. I'll go on into the city updates now. Just a reminder to everybody, the primary has been moved from the May date to June 2nd. Kelly Clark and her volunteer group are operating out of the Allison Jukebox now. They are pushing out over 1,000 masks a day, if you can imagine that. It's fantastic. They've provided masks for at least one, and in some cases more, for every City of Bloomington employee. So we're just so grateful for their efforts. And if you need masks, they are working out, again, it's Kelly Clark working out of the Allison Jukebox, and we can put you in touch with them. Let's see, we've got more and more of us are using Zoom meetings and getting better and better at it. So I think we will probably start in the near future using it a little more to bring in some more public engagement on some of the longer term projects that we have going at the city. You know, the mayor talked about this is a marathon that begins with a sprint, and we feel like the sprint part may be behind us and that we're in the marathon part now. So we'll be starting to talk about some important projects that are ongoing, because as we all know, there's life after this pandemic and important things going on in the city of Bloomington. Some happy news, both our firefighter and our Parks Department employees who had contracted COVID-19 have both either fully recovered or are well on their way to full recovery. So we're very, very grateful for that. And we wish that for everybody who's suffering right now. We're doing our best to take care of our employees. I mentioned earlier, we have masks available for everyone. Of course, we're practicing all the other things, social distancing, sanitizing, but also we have a hotel room space available, especially for our police and firefighters, because they are among the most vulnerable, and some of them have families at home who cannot afford to be exposed or even risk any kind of exposure. And so we do have some respite housing available for them. Finally, I just say we have 2 city locations out of 3 locations where they will be providing childcare in the near future, working with Tina Peterson and the Community Foundation on that. 2 of the pods will be at the Twin Lakes Rec Center and Banneker Center. So those are both city locations. And then the final location is the Boys and Girls Club. And I know they'll be pushing out more information about that very soon.
Okay, thank you, Mary Catherine. We'll next go to Monroe County Commissioner Julie Thomas.
Our best wishes, thank you so much. Our best wishes to Mayor Dawn family. It's a really hard time for a lot of folks in our community, and we're thinking of them. So, and everyone who's suffering right now. So thank you. And please pass those along from the county. So a couple of things, we are continuing our continuity of government plan. We've actually been following it since March 18th. So it's, we're coming up on a month of following continuity of government plan in emergency, and it feels like years, but it's only been a month. Huge thank you to all of our staff. Everyone at the county has just done amazing work. We continue to work with public interfacing through phone, email, Zoom meetings. And all of this is really part of the effort to continue to provide government services as best as possible under these circumstances. So for example, our highway department is sending out maintenance crews, one person in one vehicle, one person in another, and they keep their distance from each other as they work patching asphalt. So we're continuing to work, and our department has, and elected officials have been so creative about finding ways to make this work. And if anybody needs any county government services, just please go to co.monroe.in.us, check in at the website, at the webpage of the department, and you'll find information about how they're handling customer requests. We encourage people to vote by mail. Remember, the primary election's been moved to June 2nd. The county clerk's office is, you can register to vote through May 4th. They're reminding folks of that, but also highly encouraging people to please get an absentee ballot. To get an absentee ballot by mail, that means you can vote by mail. You don't have to go in early to the vote center or go on election day. And this is going to protect people's lives. We don't know what it's going to look like on June 2nd. Let's protect people's lives. Vote by mail. Just go to co.monroe.in.us, or you can call 812-349-2690. You must submit your application by May 21st. It can go snail mail. You can scan your application and email it in even. They will take that. Or you can fax it if you still have a fax machine. You're going to get the ballot to you in the mail. You simply fill it out, sign it, return it, and you have voted. And imagine how much we're going to protect our community if we all do that. So please consider doing that. The Monroe County Commissioners this week, we extended our emergency declaration through May 1st. We don't know if that will be the end of it, but we have great guidance from our health department and emergency management, who you're going to hear from today. We also want to remind folks, the Board of Commissioners wants to remind folks that because the County Council has now appropriated funding, we are proceeding with the Food and Beverage Support Grant Program for small businesses that operate outside the city of Bloomington, but in Monroe County, that are related to tourism. We are conducting interviews on a rolling basis, so if you haven't applied, co.monroe.in.us, and you can apply. We're looking to hear from farmers, restaurant owners, you name it. We are going to have our first proposals for funding next week already. So things are moving quickly. We want to get that help out to people as soon as we can. A quick note of thanks to our community who continues to practice social distancing. Thank you to all of our essential workers, first responders, healthcare workers. Big, huge thanks to our health department and emergency management. Please, let's not let up on the social distancing. It's been a long time, but this is saving lives. So please, let's keep this up. And thanks everybody for what you do.
All right, thank you, Julie. And I typed in on the chat for media. You can submit your questions on chat when we get done with some opening statements. You can also ask those here online as well. I'll next go to Brian Shockney from IU Health.
Thank you. Yes, our condolences to the mayor and Don as well. Not a difficult time for many people. And I continue to be impressed, and I'll just say it every time, with this county, Monroe County, and the partnership of all the people together, the health department, the hospital, and it's been in place for many years. And I really don't know, I do know that we would not be where we are today in the response. Penny and her team of nurses and our team working together to, every time there's something that comes up, they're there in minutes and looking for solutions. And so great leadership, Penny, and I certainly appreciate it. It makes our anxiety much less when we know we've got a community health department who's out there at every turn. So thank you again for that. You know, we continue to see incredible stories of how our caregivers are continuing to care for people, not only in the community, but also in the hospital. And the statistics went out to the press, and, you know, we just in a week's time, we've seen across the state for IU Health, over 3,600 additional patients screened, with 3,700 of those, you know, getting tested. And so, you know, we continue to see here in the South Central region this leveling off that we've heard about from IU Health, but that is it's we call it a saw blade. It's it's up and down, and with a little bit of continuous increase overall in the numbers of patients we're seeing in the hospital. So, you know, Julie is correct in her comments. We cannot let up on the gas pedal here. This all is due to what we're doing with social distancing and with wearing masks and all the things that the health department is doing and business is doing. We realize it's a sacrifice, but it's a sacrifice for the lives of people. So I want to talk about the data we just talked about. I also want to talk about the plasma donation program. We've had several questions about that. The beauty of being part of IU Health is that we're part of the IU School of Medicine, and we have some of the best research minds in the world, the largest medical school in the nation. And we are doing some experimenting downtown through our IRB, our review board, regarding some of this early evidence on plasma and giving this to some of our sickest patients. And so those who have been, who've recovered from COVID, we're asking that they would donate plasma at our centers, and that they would allow us to use that to care for patients. And so there's some questions also around serology testing, which is antibody testing. There's really not a lot of good evidence out there right now. That's why this is being done as though it were a research project and very tight scrutiny, and only on certain patients. But we hope that soon, IU Health is doing some great things. When there's widespread testing, we'll be able to know more information when we get to that point. But IU Health continues to work on this serology testing across our state and with our labs. And so we hope to be having some developments there in the near future. Testing expansion, just a couple reminders to our community. Testing expansion has occurred if you have an IU Health physician, or if you'd like to go to our Landmark Center, where we now have a clinic open that you can go to at 550 Landmark, and they can screen you. We also have our nurse screening here, where if you call your doctor's office, they will put you through to this line. They will screen you, and if you meet those criteria, they will actually set you up an appointment to get your testing. So please take advantage of that. We want all of our citizens to be sure that they know where, if they have COVID and relating to their symptoms, and if they need to quarantine, and where they are in their disease process, if in fact they have it. So we do have virtual visits. We have now done almost 2,000 virtual visits. And as we heard today, regarding maybe restarting some locations around the nation, or planning 14 days or 3-4 weeks from now, looking at what it might be to restart some of our economies. We know that there's going to be some need for testing and other things, and we're working on that currently. and what that looks like. But we just need to continue to be diligent in our efforts around social distancing and making sure that we don't do things that would get us to a point where this leveling off or this jigsaw of the curve takes a spike and stresses our system. So I just want to say thank you to our community for what they have done, our business community, the city and county for the support that they're giving them through these dollars that they're finding. But this social distancing and the work that everyone's doing has truly been the key factor in this not overtaxing our healthcare system, and it's saved lives. Let's continue to do so. Thank you.
All right, thanks, Brian. So next we'll go to Monroe County Health Department Administrator Penny Caudle.
Good afternoon, everybody. I started to say good morning. I've lost track of what day it is, what time it is, and all of that. Again, share condolences to the mayor's family for the loss in their family. Just want to reiterate, I think what everyone has already said today, and that is that we need to continue doing what we're doing. So as we look at today's numbers in Indiana, there's 642 new cases and over 10,000 total cases confirmed in Indiana, but over 54,000 people have been tested. And in Monroe County, we've had 108 confirmed cases. We have unfortunately seen some deaths, and we've had 3 deaths so far. We have had over 700, almost 800 tests reported to date. And now that the negative tests are also reported to the state health department, we will have a clearer picture on what's going on with that testing. So I would reiterate that the numbers really confirm that what we're doing and what our community has been doing, what's in place, is working, it's prudent, and we need to continue that. We don't want to increase the demand on our hospital and our healthcare workers. We want to slow the spread of the virus in our community. We want people to be as safe as possible. And practicing what we've been doing, washing our hands and not touching our face, doing the social distancing that we talk about, wearing those face coverings when we're out in public, running the essential errands that we need to run. And we can't guarantee that we're going to have that distancing. And with that, I know everyone has talked about this from time to time, and the mayor talked about it the other night at City Council, that when we talk about social distancing, we are talking about physical distancing. So keeping that 6 feet between us so that we're not spreading the infection from those droplets. But we aren't talking about disconnecting from one another. And at this time, it is even more important than ever that we maintain those close communications and those connections that we have with our family. I was talking to somebody, I think from our jail staff, but in our county the other day, who just mentioned they live alone, and it's very difficult when they can't go out and see their friends and have those communications like they normally do. And we have to recognize that a lot of people handle that much better than others. And so we need to reach out, think about the things we can do to support one another. Can we call them on the phone? Can we check in with them, whether it's a text or a phone call? I have some friends who've been meeting over Zoom, we can't go out for dinner, but maybe we can have our little dinner party over Zoom kind of thing. So doing some of those things, but maybe it's writing a letter. We don't do much of that anymore, but finding ways to connect with one another. The other thing that I would encourage people to do is check in on your neighbors, your friends, your family. If you're running an essential errand and they can't or they shouldn't, can you pick something up for them? And that goes a long way in making people feel good, know that you're there, supporting them. And again, just focusing on what we need to do. As we look at the data, we see that we are seeing disparity perhaps in terms of cases and deaths, and we'll be watching that. And we know that the state and our epidemiologists and our researchers will be looking at those disparities as well, so that as we learn more about what's going on with this virus and look at all the data, we'll learn lots more on lots of different topics of that. So I don't have much information. I've been asked about the disparities. I don't have a lot of concrete information to give other than that we are watching that and concerned about it. We are doing some peer education training or education, and our public staff and our public health coordinator are doing some education through Zoom to educate some peers and do some social distancing and how to wear face covering and the importance of hand sanitizer or washing hands among people who may be experiencing homelessness, so that we can get those, the bandanas and the information for face coverings out to them, but also we can make sure that they're armed with the information. We're also including naloxone training with that. We want to make sure that people have naloxone if they need it in case there's an overdose. So we are working on that as part of our strategy to educate all of our populations. And I will say that I know that there's been some concerns about people who are experiencing homelessness and how they're congregating, but I have been past some areas and I've actually been rather impressed with the distancing. And so I'm sure that different times of day, as with everybody, different places we go, we see people who are practicing good skills in terms of what we're advocating and some who still need to be educated. So we are working on that together. A couple other things that we have going on, our food staff and the city market staff are continuing to work together on ways that as we come into summer and the farmers market might be increased, how can we do that safely? How can we maintain the procedures and provide the essential service and the food, but also meet the guidelines that are in place in terms of social distancing, the number of people who are in places, because we have this twofold. We all need food, we need the essentials of life, but we also have to protect everybody's health, that of the vendors, that of our staff, that of the communities. So just know that the market staff and our food staff and the health department are working closely together on those things. Monroe County, as with many things, we have one of the most robust markets, one of the largest markets in the state, if not the largest. And so with that comes some challenges that other communities may not be facing. But know that we're working on that together to provide the best service in the safest manner possible. Brian, you talked about our partnership and relationship, and I want to reiterate that. I don't know that everybody in the community really understands the unique relationship that the county has with the hospital, in that we contract for those public health nurses, and they're both IU Health employees and their health department staff kind of as well. They're not paid by the health department, but we contract for those services. And that enhances our ability to provide service in our community. And they are wonderful, absolutely wonderful. So I think that's what I have for the moment, unless there are questions later on.
Okay, let's go to Monroe County Emergency Management Director, Allison Moore.
Good afternoon. We are starting to plan for the new normal. We're not sure when that's going to happen, but we do know that's going to be in our future. And so we are currently looking at all plans and procedures and how we can make some implementations to get us to what that new normal will be. And we're working and requesting guidance from the Indiana Department of Homeland Security so we can begin those plans and procedures now so that we will be best prepared to continue services to the county and the Monroe County residents as we continue to move through this pandemic. We continue to shuffle and secure all of our resources around for public safety for our first responders to ensure that they all have PPE. At times, it's somewhat of a game. If I take this from you and I shuffle this to you, we can all have, various resources and various things that each department needs. Amongst the collaboration amongst the departments has been wonderful. All the different chiefs and various departments are so willing to try to shuffle things around and make it all work for every first responder in the county. So the work that goes behind it and the collaboration that goes behind it has just been phenomenal. I'm so impressed with the willingness for all of them to serve together. And it's been quite a challenge this week, but it's been so successful, rightfully so. So we also, Mary Catherine talked about the housing available for our first responders. And I just wanted to make note of that's available for all county responders, not just the city, but we're working with the city and then any other department to secure that respite housing. And that is now available, and our departments are all aware of that. Some of our hotels and motels in the county have stepped up and are willing to work with us on that. And that also has been wonderful collaboration. We, as Ms. Thomas talked about, we did file a local declaration this past Wednesday through May 1st. And our department did get that filed with the Indiana Department of Homeland Security. So we are officially under that local declaration through May 1st, and everything has been filed. We are continuing to collect the homemade masks to be used for face coverings. And we, as I have mentioned on numerous calls, are collecting those at various sites throughout the county. Those donations are becoming fewer and fewer. And I understand that, many families are working with e-learning and doing lots of other things, but I would like to challenge you and continue to challenge you to make those masks if that's something that you have the ability to do. And we can continue to collect those because our list of places that need those masks continue to grow. And lastly, I just want to thank Monroe County residents for using the social distancing. And I would like to challenge you to continue in this time more than ever. If we could continue the great things that you guys are doing by social distancing from one another, it really does make a difference. And we want to continue those efforts. And we are proud of what Monroe County is doing and how you're continuing to stay home. And I know it's been long and I know it's challenging, but we want to continue to challenge those efforts and do so. Chuck, thank you. That's all I have.
All right, thank you. Let's go next to IU Associate VP for Public Safety and Institutional Assurance, Ben Hunter.
Thanks, Chuck. Like the rest, Indiana University and me personally, we extend our condolences to the mayor and his wife on the loss as well. So the other common theme amongst everyone is that we're doing a lot of planning, and we continue to do that in Indiana University. For example, as we've transitioned to more of a virtual instruction over the last few weeks, we've seen that to be about 100,000 virtual Zoom classes and meetings that have taken place within Indiana University. That equates to about 600,000 participants and 20 million minutes of connected time. So we have done that with very little problems. We've been very impressed with our faculty and our staff and our students in that transition. It's worked out quite well, and it's a great model for us. And we'll continue to move things over to virtual settings, including student services. I know the police department are even doing Zoom roll calls to make sure that they're doing physical distancing within the same shift. So we've seen a lot of innovative things with the challenges that we have currently right now. As most of you know, we did close our residence halls and on campus, and we're moving Briscoe for use for IU Health. We continue to work with them and our environmental health and safety teams to make sure that environment is safe and putting all of those things in place. The most significant thing to report is that President McRobbie and our Board of Trustees announced that he has started a restart committee. That's going to be chaired by IU Executive Vice President and Dean of the IU School of Medicine, Dr. Jay Hess. We'll also have both our public health deans on there, Dr. Paul Halverson and Dr. David Allison will join that. And within the IU system, we have several subcommittees that are working to look at what a restart looks like. So we'll take direction from that restart committee that will look at, national and local trends, what is going on, and give us the public health advice. And then the committees that we have will operationalize that. There'll be a lot of work moving forward. I see a question came in about sketching out the timeline for the university to make a decision to hold in-person instruction in the fall. Right now, that rests with the direction of looking at that restart committee and seeing exactly what those trends are. And at that point, once we can get additional direction, we'll be able to make a decision in regards to that. In terms of the national, I know the White House released their kind of opening of America guidelines last night, where our team is looking at that. We're anxious to see what the governor announces today and in the coming weeks. And then that will equate to the direction that we have at Indiana University in terms of looking at all the data, all the things that we need to consider to make sure that we have a healthy environment for our faculty, staff, and students. And so that is going on all our campuses and are being led by our executive policy group. Throughout Indiana University, we have froze the hiring of staff. We're prioritizing our faculty hires in terms of looking at those issues. We've froze our mid-year salary increases. So we continue to look at all of these kind of larger issues to put us in a footing that when and if and as we return to normal, we are prepared to operate and move forward for our faculty and our staff and our students. We really are looking forward to getting students back on campus. I know I've talked to many units and departments, and they miss our students. They miss our faculty. They miss the staff. Our hallways are empty. We do have our essential employees on campus. Our essential research teams are still on campus, but it's just simply not the same. And if you've walked around to try to get out of your home on any of our campuses, particularly the IU Bloomington campus, you can just see that it's just not the same. When you can look through our campus and not see anybody and walk for several minutes without seeing anybody, it's one of the things that we look forward to figuring out in a safe and healthy way how we can bring back our faculty, staff, and students. So we are just really in a massive planning effort right now as we look to see what the future holds, and we remain optimistic. On the public safety front, we continue to work to procure PPE, and we continue to assist on mutual aid requests. Our police departments continue to work together to patrol on and off campus. We really haven't had a lot of off-campus partying issues or student issues. I'm reminded that I think this weekend, time escapes me, but I think this weekend would have been Little Fives. So it's vastly different than what we're used to for both our IUPD and our partners with Bloomington City Police Department. But I'm happy to answer any questions about our planning efforts, but that's the mode we're in right now.
All right, thank you, Ben. And if you want to see, by the way, how many PPEs we've been able to send out from Indiana University, that is in a story on our news.iu.edu website. We want to go to several questions we've had come in from Emily Ernsberger from the Herald Times. First of all, for Mary Catherine, the HT staff sends their condolences to the Hamilton Johnson family. She asks, is Ms. Johnson still in the hospital? And if not, when was she discharged?
Thank you for those condolences. And yes, Dawn Johnson is still hospitalized. She's getting great treatment.
Okay. For Brian, as more area nursing homes have residents with COVID-19, are you seeing an increase in patients being transported to IU health facilities for care? And how is the hospital collaborating with these entities to protect this vulnerable population?
Yeah, that's been a concern around the country. Luckily, and the planning from IU Health, we have a population health program that reaches out and has been for the past 2 years, meeting monthly with all area nursing home partners to talk about how we manage care and keep them from readmitting to the hospital and admitting to the hospital. And so we have case managers who are connected with those nursing homes in our community and have been for the past 2 years. So we have not seen that here. Just the opposite of that, we've seen great collaboration in this region at all of our hospitals in this region because of that population health management program that's been strongly in place for the last 2 years. So as we discharge, if there are patients, and there are a few that come to us, we know about that. They let us know about that. And then we follow them back through virtual visits and through continuous contact with them daily at the nursing homes when they go back. So again, we in this, with IU Health, have been blessed with that population health program for 2 years, where we have full-time case managers that work with our nursing homes, and then monthly and quarterly meetings with all of the nursing homes who are part of that program.
This one for Brian or Penny Caudle. With new models and estimations about the state's potential surge being pushed back, do you have any estimate as to when we can expect a local surge?
Myself there. You know, the models are just that. They're models and they're estimations, and we really won't know when we have hit a surge or a peak until we're through it. And so I don't think that there's a good indicator. We can't say we know when that's going to happen. I think we have to just continue to do what we're doing and watch the numbers, and so that as we plateau, Brian talked about this earlier, we're going to see sort of that roller coaster look, and we don't want to think that we've peaked or say this is going to happen on this date, and even be kind of at a plateau and have people think that they can stop doing what we're doing and then have a resurgence. So we really have to be mindful that this is a difficult thing and impossible to really predict. And we're really not going to know we've hit that peak until it's passed.
And I would say, you know, we continue to, at our IU Health facilities across the state to run at very high census levels of COVID patients. We're discharging patients every day, but we're also admitting patients every day. And we still have our units very busy and very full of patients. Thank goodness we are not over our capacity, and we have all the equipment and everything we need, and the patients are not requiring the ventilators that we have available. That's all great news. But I think there can be a false sense of security when we see this flattening of the curve, which is, if you remember 4 weeks ago, that's exactly what the Surgeon General and everyone and CDC was saying we wanted. And so we're doing what we wanted in the very beginning. The concern here is that we get this false sense of security and that curve does not stay flat. But please remember, we discharge and admit patients every day, and our team members in our hospitals across the state are caring for a high number of COVID and very complex patients continuously every day. That curve has not gone down, it's just flattened.
Okay, Brian, sticking with you, this is from David Askins at the B-Town Beacon. You mentioned how additional testing is probably going to be necessary for a reopening of the economy. How close is IU Health to being able to offer a COVID-19 test to rank and file members of the public who are not symptomatic?
Yeah, so there's two types of testing. One is the tests that we're doing now regarding, do you have COVID-19? And that test is just that. It's, do you have symptoms? And then we test to see. It's not a test that if I would get it currently without any symptoms, that's really going to tell you if tomorrow I'm at work, I have it and I'm spreading it. Then the second test is a serology test. That's that antibody test. And I would point you to two articles that I think have been helpful for us. One is from Scientific American. It's from Stacy McKenna on April 10th. And then the other one is a New England Journal of Medicine article on April 13th by Amy Herman, just kind of a statement from her. And this is very complicated, it's very early. There is some research in this area, but there is no scientific consensus in individuals who have recovered. And actually there is some evidence in other countries where it acts differently. So someone who, like with the common cold, we can get the common cold, and then 2 weeks later after recovery, we can get it again. And there's some evidence around that here. So there's a lot of work going on. I will say there is lots of research dollars and very smart brains, smarter than me, much smarter that are going into this to help us here, but it's going to be a while before we have testing, I believe, and all indications I can see that are really, we can hang our hat on and say, we can test people and know for sure whether they can go in the workplace unprotected, without social distancing, and not be exposed to the virus.
Okay, for Julie Thomas, about the county's food and beverage tax support program, you said that grants so for the county, it's not a loan program as the city's is, but as a straight up grant program.
That's correct. It is a grant program. Thanks for the question, David. It is a grant program, and we're going to be asking for some receipts and things like that. We're also asking that if a business owner has applied, receives a grant, that if they do receive other funding mechanisms or their business recovers quickly through another means, like a web service or something, that they refund the money back to the county. But no, we're going with grants.
Okay, from Ethan Burks from WTIU, for Penny or Brian, the Scott County Health Department is offering free testing to anyone who experienced symptoms in the last 2 weeks. On their Facebook page, it says there's no pre-screening required. People can just drive up in their cars. Is Monroe County equipped to offer this service? Would the landmark location be the answer?
Oh, I can speak on behalf of IU Health. We are expanding our testing now, but there's really no evidence that if you don't have symptoms, that that test is going to tell us a whole lot. So we really want to be sure that we're testing patients who have symptoms, and our numbers of tests, as we talked about before, have gone up by the thousands. And so we are testing a lot more at that landmark location. As looking further down the road, another phase of testing could be in that category. However, again, I would caution us to, if you look at testing individuals who don't have symptoms, especially this time of year, like me with allergies and those kind of things, it really isn't efficacious to do that. And so it gives peace of mind. I will say it may give some people peace of mind, but it doesn't mean tomorrow that I may not be shedding the virus. So I just think we have to be real careful and use the scientific evidence, use the CDC, and try to alleviate that anxiety with education and communication, and not with just testing.
And I would add on to that, Ethan, that we do have part of our preparedness plans include points of distribution, whether we're doing vaccination clinics or whether we're doing some sort of testing. So if and when testing is widely available and we need to set up a testing site, then we could certainly work to do that. I was actually trying to kind of pull that up when I saw that question come up. I don't know who's actually doing the testing for them in Scott County or what their process is. So I can't speak directly to them. I do know that the state health department has been putting together some drive-through clinics. They did one in Maryville, and they've got a couple planned in southern Indiana. I did not think Scott County was one of the counties, but that could have changed. And so there are some drive-through clinics that the state health department is conducting in conjunction with those local health departments. I think it was Vanderburgh County and Clark County that they were looking at. I haven't heard that those were actually scheduled and have ran yet. So it's possible something moved to Scott County or that it was expanded. So it could be in relation to that.
Okay, we've got just a couple of minutes. I'm going to try to get a couple of questions in quickly. First, for Mary Catherine, do we have an update on the city for Rapid Relief Fund applications? How soon will businesses receive money if approved?
We do. Just today we have news, and I'm so glad they asked this question because I should have included it in my comments, but $500,000 was approved just today. There will be just a little follow-up paperwork once they've been approved, which happened today. As soon as that paperwork is returned, then the checks will be cut. They should receive their money within 24 hours after returning their paperwork.
Okay, and then turn to Ben. How have things been going? This is from Jenny at the HT. How have things been going with using the IU Residence Hall for healthcare workers? That obviously referring to Briscoe.
So they're not in Briscoe yet. We set a goal to have, because when we shut down the dorms, students left their stuff. So we had a goal till today to get that packed. We've been working with students in RPS. So we had movers come in. We announced that to students and their families. And today is the day that we'll be finished. And then we'll be able to turn it over to IU Health. And then at that point, if they need it, they'll populate Briscoe. In terms of our ability to get this done and work with IU Health, that's been going great. It's seamless, obviously, we have a great relationship with IU Health throughout the state. And we're doing the same thing for a dormitory on the Indianapolis campus at IUPUI, but they should be ready this weekend for IU Health to control the buildings.
Okay. All right, well, we are out of time for the Facebook questions that have come in. I know we've been trying to get some answers up there as well. We'll try to answer those on there also. Again, we will do this again next Friday. We'll send out an advisory to media at that time, and again, stream on Facebook as well. So thank you all for joining us, and thank you for your questions.
Thank you.